Hi, my name is Rosie Bansal. I'm a fitness and nutrition consultant. And with me here, we have Dr. Nita Nair from Apollo Cancer Centers, Navi Mumbai, who is a lead consultant breast surgery. She's here to answer a lot of questions that we have revolving around breast cancer. My first question to you is, breast cancer होने के ऐसे कौन से signs and symptoms हैं that we should be careful of?
So the way breast cancer is, it comes as a painless lump most often. Fortunately, not every lump in the breast is going to be cancer.
Okay.
But if you don't, I'd say, diagnose it or evaluate it early, you miss the opportunity to be able to detect cancer early.
Okay.
So the most common signs and symptoms for breast cancer would be a painless lump in the breast or the axilla, maybe discharge from the nipple, which is something that is either blood-stained or staining your bra and coming out spontaneously.
Oh.
Or changes on the skin. So changes on the skin can be thickening of the skin, can be indrawing of the nipple or indrawing of the skin. These are mostly what we'd like to be able to pick up patients on as early cancers.
But this is actually very, very important information as well. Doctor, another question that I have been asked, by one of my known persons in the circle is that hair dye लगाने से भी क्या cancer हो जाता है?
So,
breast cancer?
Fortunately, नहीं. But unfortunately, this is a very common myth. ये हमारे society में बहुत myths हैं that circulate. The first is dyes cause cancer, breast cancer. The second is black bra पहनने से cancer होता है.
This is one which I've heard a lot.
The third is underwire bra पहनने से cancer होता है. These are all myths. Breast cancer उस तरीके का cancer है that we don't know how to prevent it. We know certain risk factors. Some of the risk factors we can't do anything about. Those we call non-modifiable. That would be being women, aging, having family history, certain exposure to hormones, which is when our periods started, when our periods stopped. Okay. But what we can change is the kind of other risk factors. So if you have your first child before the age of 30, that reduces your risk. Oh. If you breastfeed your child, that reduces your risk. If you exercise, lose weight, that reduces your risk. So these are things that we can do and take control of our health, and that's what we encourage our women to do.
Doctor, when somebody goes through breast cancer, there is a lot of emotional turmoil, a lot of physical turmoil, mental turmoil, financial turmoil, of course. So for the patient and for the attendants of the patient, the family members, the core support group for the patient, what would be few of those tips that you would talk about that, be prepared?
So
how?
So I think that's a very good point that you brought up. One is that the way our society works, the entire family goes through cancer. Yes. It's never just the patient. Financial, what I can tell you is that governments are coming in a big way. We are changing a lot of what we call formulations available. There are, from generics, we go to newer molecules available. You get, once the patent of a certain molecule is released, you get a lot of generics available in the system. What this allows is it lets us bring the cost down of medication.
That is a consolation.
So a lot of that has moved forward with breast cancer. One of the common examples I gave is there's a drug which we call targeted therapy in breast cancer. Okay. When it started, we used to offer it for 1 year. It was an average of about, I'd say, 12 to 13 lakhs for just that drug for the patient to take.
That is a whooping amount.
So we looked at data and said that maybe 4 to 5% of our population in India who is eligible to take that drug for cancer was actually able to. You moved, and this I'm talking about is 2008, 2009 when the drug came out. And it was a revelation in breast cancer care. But it was not of access to our patients, so it made no difference. You jump to 2023, not only has that drug gone out of patent, so there are a lot of Indian molecules available, so making it much cheaper. We've looked at giving shorter course treatments, and almost about 90% of our women who are eligible for it now get access to it. So that's something that I think governments and organizations and oncologists have come together for financial burden. Yes, it does require a lot of treatment. So breast cancer, unfortunately, is not treated by one modality of therapy. When it's curative, we are giving surgery, chemotherapy, radiation, hormone, targeted, depending on the type of cancer, depending on the age of the patient, depending on the receptors. So a lot of things come into combination. It does escalate cost a little, but I will tell you, most oncologists take that into account because we want our patients to live happily and live longer happily. As for physical, breast cancer is one of those that because we are seeing women live longer, we've moved a lot of our efforts towards better quality of life. So whether we talk about breast conserving surgery now being our standard of care, we've moved towards a lot of oncoplastic work where we try and hide scars, we create the mound similar to the opposite side. We give women better body image issues so that they are happier in the long term.
And plus much more confident.
And more confident. So for all patients that are on treatment for breast cancer, I would encourage you to do some form of yoga. By yoga, I don't mean asanas and vigorous power yoga. Simple breathing and pranayama makes a lot of difference while on treatment and follow-up and reduces fatigue. And it takes care of a lot of quality of life issues for women.
Wonderful. I mean, this entire conversation has been an eye-opener, Doctor. So thank you so much, Doctor, for taking the time out. And I'm sure जिस तरह से मुझे बहुत सारे सवालों के जवाब मिल गए, I'm sure आपको भी आज बहुत सारे सवालों के आपके जवाब मिल गए होंगे. So if you really liked this conversation between Dr. Nita and myself, please go ahead, share this video with as many people in your community as well. And please encourage people to listen to all of these conversations that we have. They're very helpful. Last but not least, as Dr. Nita also said, अपनी health पे ज़रूर focus करिए. Health and nutrition is very, very important if you want to have a longer lifespan and अगर आप healthily जीना चाहते हैं. Thank you so much.
Thank you.